as I think I said yesterday, that I'm an unhappy doctor. I keep trying to solve problems, and we do that serially. So we take on a new technology, we take on a new concept, a new idea, we milk it. We do whatever we can with it. We do it. We're intensive with it, and then we integrate it into everything else that we do, and then we say, okay, what's left over? And then we add the next thing, and that next thing could be pretty random in terms of what comes up. But that next thing may solve a particular problem we have at that time. And then you move on. So basically my moving on was having done all these different things and said, what's the value? How many problems am I going to solve? How many people can I help the most with this one technology? And so as a result, I said, okay, the value, as you said, the value is with PEMF therapy. It can do so many things. You just have to have the right equipment. And unfortunately, if you buy the wrong piece of equipment, you're not going to see the value that you may want. And that's part of my 30-year journey with magnetic field therapy. I started off with very weak magnetic systems to work with. I started off with magnets that you put on acupuncture points. Talk about weak magnetic systems. And then you learn the limitations, and they say, okay, well, that's not solving enough problems. Then what's next? Then what's next? Then what's next? And ultimately, when you synthesize or integrate everything, you say, okay, this is the best value. But my perspective has been, as a family physician primarily, is I teach people to take care of themselves. Right? I can give them medications, I can send them to PT, I can refer them to a surgeon, I can do all these things, but ultimately they have to take care of themselves. Because I learned a long time ago that I'm not the arbiter of their health. So in other words, I tell my patients all the time, I'm not your doctor. Right? You're your doctor. I'm your consultant. You got to take care of yourself, because when you walk out that door, I have no control over what happens next.
Right.
Absolutely. This is true.
You know, Dr. Pawluk, I have questions from last time I'll go over, but one of the frustrations that we have when we're managing chronic diseases that people tend to be, you know, they want instantaneous gratification, or kind of like what you inferred, front runners. So they'll try something, they'll stick with it for a little while, but oftentimes I find out they don't stick with it long enough to really see the kind of effect. I think everything, you know, you talked about the 1/X and all that. Most things in nature are log linear, you know, or asymptotic. When it comes to dementia and some autoimmune diseases, we see results. We see almost nothing for several months, and then all of a sudden we see this inflection of improvement. And a lot of people don't have the endurance to last beyond this low part of that curve. What do you think the real, let's just pick someone with, say, neck and back pain and things like that, pretty severe, but, you know, not debilitating, they're still active. What is sort of the frequency of dosing, and how long do you have to go before, you know, you might feel some little placebo effect in one shot, or maybe some real effect, but to really start seeing, you know, a profound benefit from this type of treatment?
Well, you know, our standard answer to our patients who ask us this question is it depends.
Yeah.
Right? It depends on the tissue, depends on the pathology, depends on the health of the person in general. So, and the answer to your question, I'll give you some examples.
There we go.
All right. So I may have told this story. I had a spider bite. I didn't even know I got bit, but I had an itch on my leg. I looked down and there was a quarter-sized lesion. To me, it looked pretty familiar as certainly an insect bite. I thought it was probably a spider bite. So I slapped a big, thick magnet on it, you know, taped it on, and I was reading on my back porch, reading a book. And so 3 hours later, I never paid attention. 3 hours later, gone.
Oh, wow.
So if it was truly a spider bite, 3 hours later, it's gone. And as a physician, I've seen spider bites many times over the years, and I know it's a 2 to 3 week process.
Absolutely.
Right?
Yeah.
So bang, gone, done. Now, I happen to be lucky because it was right away. My wife broke her little toe on lawn furniture. So what do? Well, you buddy tape it, you put her in a platform shoe. She's a nurse, and that's a bad idea. Doctors marrying nurses. And she refused to get an x-ray. So I said, well, I'm going to assume because of the discoloration, because it was bent out and so on, that it's probably a fracture. Well, she refused to get an x-ray. So I said, fine, we'll treat it as a fracture. So platform shoe, buddy taping, and magnetic therapy. A battery operated device that we strapped to her foot, to her toe that she broke. And she wore it continuously for 24 hours. So midday, slapped it on. Next morning, she woke up, no bruising, no swelling, and no pain.
Wow. Beautiful.
But, okay, knowing that if it's a fracture, it's not going to heal that fast.
Right.
So I had her continue to do it for another 24 hours. And she walked a mile in tennis shoes. Had her continue it for another 24 hours. She walked 3 miles in tennis shoes, and that's it. She took it off.
That's amazing. That's amazing.
What about things like scars, or if you do surgery, and you can apparently break some meridians? Obviously, you want to use this sooner than later, maybe even before and after. But have you had any successes with those kinds of situations?
Well, again, a personal story.
There you go.
I had an appendectomy. I had a partial cecectomy for a lipid tumor that I had in the ostium of my appendix. And we didn't know what it was, so we removed it, and bingo, it turned out to be benign. So I had 3 stab wounds in my belly. So I took that same machine that I used for my wife, and I put it over 2 of the stab wounds and kept the other one as a control. So that was Friday midday. Now, being a physician, I'm not lifting and I'm not carrying and I'm jumping and all that kind of stuff. But Monday, I was back to work. Using the magnetic therapy continuously for that whole period of time.
So you elicited a question, of course, which would be, how do we get one of these magnets?
Well, they're easy to get. So
magnets, I got all kinds of magnets.
Yeah, Jody.
Well, I mean, that's an important question, because if I had all the money in the world, what devices would I get? And I can tell you right now, it's not one. There's going to be 3 or 4 different devices.
Yep.
One is one I use on my wife and my belly, and that's a low intensity portable battery operated machine. And the one I recommend is called a micropulse or a flex pulse. I worked initially with the micropulse, which then became actually called somopulse, which became the micropulse, and then we wanted to add the number of frequencies and programs in it, so that became the flex pulse. So the micropulse is what I used on her. So that's easy enough to use for a tennis elbow or a small little fracture. But if you want to do whole body magnetic therapy, then you need a whole body system. And as I mentioned last night, then you want to have depending on the problem you're treating, if you're just trying to do health maintenance, you could do a very low intensity whole body system just to tune your meridians. And that doesn't have to be that expensive. You could spend $3,500 or $2,500 for a whole body magnetic system. That's reasonable in intensity. So that's one that you probably want to have too. The next one is very high intensity, whole body, high intensity. You may want to do a small high intensity system, for local treatments to get better results faster. So that could be another system. So in the book, Supercharge Your Health, I have examples of all of these different devices. So if you had the money you wanted, you'd have like 3 or 4 different devices for the different problems that would come up in life.
And I sent over to Jody, the different brands and so forth. So she'll send that out. Jody can put that in the chat. And then there are various discounts that apply to each one of those. Obviously, the more expensive, the better discount and so forth.
That's the referral partner program.
Yeah, exactly. So yeah, Jody will send that out to our participants so that they can kind of follow that, and then they can obviously also do a consult with you and your team to kind of hone in on what may be, the best system for them based on their ailments,
their problem that they need, or what they're willing to spend most often. So go back to your Tom, to go back to your question. If all I'm dealing with is back pain, and that's all they really have is just back pain, then I want a reasonably high intensity magnetic system, because you're not talking about that much depth. So you want a reasonably high intensity local magnetic system. Probably 1,000 to 2,000 Gauss would work pretty well. And of course, once you get that for your back pain, it's good for all sorts of other problems that are going to be within the range of that particular machine. But again, if I talk about osteoporosis, or I talk about stage 4 cancer, I just spoke to a guy today actually who has stage 4 prostate cancer and lymphoma. So he bought himself a very high intensity local PEMF system. And I said, forget about it.
Ouch.
Well, fortunately, he hasn't received it yet, so he's just going to refuse to accept the delivery. But he needs a very high intensity whole body PEMF system, preferably a magnetic sandwich, so that you can stimulate all the bones to make sure the bones stay quiet and non-inflamed, so he doesn't get prostate mets into his bones. So at this point, he doesn't have any prostate mets. He's got a lymph node, and there's something else brewing based on a PET CT. So I said, you need a whole body PEMF, high intensity whole body PEMF system. Now that's probably going to serve him for almost everything he's going to need, because he could lower the intensity. He could always go up, and you can go down, but you can't go up too high. So if you get the wrong machine and you can't go up too high, say for example, if you're treating breast cancer, all you're doing is treating across the chest. You don't need anything that big, because for most women, the breasts are not going to be 6 inches deep. So you can get by with a smaller system, but that's not the problem. The problem is the stem cells that are in those bones already. Right. So if I just treated the chest, I'm going to help her to recover from the mastectomy or lumpectomy or whatever, protect that breast from getting another tumor, and protect the opposite breast from getting a tumor. But I'm not really treating her. If all she's interested in is just treating locally, that's fine. We'll give her a system for that. But you have to understand, you're not going to take care of the risks down the road. And many people obviously don't care about prevention. They're just their interests are just short term. So if you have the ability to recommend different devices based on the problem that you're dealing with, and thinking about their needs in general over time, then you're probably going to pick a system that's going to give them the most value over time.
Right.
So have there been cases, though, you gave us some short-term cases, have there been some refractory cases, but when they stuck with it, eventually saw results?
All the time with back pain. So again, with back pain, what are you trying to accomplish? I mean, one of the early effects of PEMF therapy is anti-nociceptive. It has a natural pain-killing effect like Tylenol or codeine, right? But it's not going to heal anything, so the pain comes back when the dose wears off. So some people feel amazing results right away. Bang, they're deliriously happy. If you have a reverberating PEMF circuit in the nerves locally, small nerve structures, and you put a magnet on it, sometimes you can get immediate relief and gone. Permanently gone, because you've basically reset all those nerves in that area. But with spinal stenosis, you got an enduring problem. It's never going away.
Right. Yeah.
Right. So you can get benefits if you do intensive treatments. You can get maybe a 3, 4, 5, 6, 8 week benefit, and then it's going to come back. Because what they do is they start getting active. Another example, I had a goalie who lost his college scholarship in hockey. And he did conventional therapies, PT, PMNR, pain management, all that stuff for years, for 2 years approximately. So I got him on a micropulse. That's all he could afford at the time. And he used it continuously for about a week to 2 weeks. Miraculous. All the pain's gone. So it was a groin injury. What did he do? Because he's in his 20s. What did he do? He started going out and exercising and playing and pushing and so on. And bang, within about 3 to 4 days, he was back to where he started, actually before where he started.
Oh, right. Okay.
Because the tissues weren't healed yet. Well, trainers know this, right? You push, you treat, you push, you test, you back off if they fail. You treat some more, you push, you back off if they fail. And you continue ratcheting up gradually until finally they've achieved the goals that they're looking for to achieve. So understanding pathophysiology, we understand these things. So people tend to go back to their normal activities way too soon and way too aggressively. Going back to your point, Tom, that how much treatment time do you need?
Well, you need treatment, then you need to be able to let the body heal as well without putting force on it.
Right.
So there was a little point of confusion, I think, because you talked about bone cancer, lymphoma, I think lymphoma. So you want to go deep on both sides, but what did you use for the prostate cancer? Was it same kind of treatment, very deep and whole body?
Well, again, I think you're not just dealing with the local prostate cancer.
Sure.
So there's a book I recommend called The Great Prostate Hoax.
Mm-hmm.
I routinely recommend this book. It's written by the guy who actually discovered the PSA.
Oh, wow. Okay.
All right. And he said and I knew this, I read other research that talked about this as well, that said basically it doesn't matter what you do with prostate cancer. They're going to get Mets in 15 years, 12 to 15 years. And if you do surgery, you do radiation, they're impotent and incontinent for the 12 to 15 years that they're waiting to get a metastatic cancer.
Right.
So why not just treat yourself, holistically, without harm or risk, and just wait for the events to happen. So my idea there was that I don't want the Mets to happen. So basically, I'm recommending to them that you need to be aggressive in treating the rest of your body. And I routinely recommend ozone and IV vitamin C and IV ALA and hyperbaric oxygen. All these other therapies work in combination with the PEMFs to deliver an even better result. Once you've done those intensively for 3 to 6 months, then you can begin to back off and continue the high intensity magnetic therapy for the rest of their life.
Okay.
And that's what's going to keep it from coming back. Or if it comes back, it's not so bad. I had a patient a colleague actually, who had initially discovered to have colon cancer. He lived in the Netherlands. I talked to him regularly. He was having these abdominal problems. I said, you got to have a CT scan or a colonoscopy. Well, he went to his GP, and in the Netherlands, they don't do routine colonoscopies at age 50 or thereafter. So anyway, 2 years later, finally had a colonoscopy. Stage 4 cancer. He already had peritoneal metastases and everything. He had high PEC. He had all kinds of things. We continued magnetic field therapy, did holistic medicine with him. He survived 7 years, stage 4 cancer.
Okay.
Now, it wasn't an event-free 7 years. It wasn't a pain-free 7 years, but he lived 7 years.
Right.
That's well beyond expectations. Yeah.
Right. Absolutely. Yeah.
What about metal implants, silicone, saline implants, plastic joints, etc.?
So we talked a little bit about contraindications, and there's really only one in my mind that's absolute, and that is transplants. So don't do magnetic therapy in somebody with transplants, even on a big toe. So heavy metals are not a problem. The problem with metal generally is that the magnetic field is going to bend around the metal, and it may concentrate. So the biggest problems I see, and I actually have some dental implants, and when I do high intensity magnetic therapy around my face, I get these sharp stinging pains. So I'm aggravating nerves that are still sensitized around the area of both the cavitation that I had and also now the metal implant. So basically, watch the intensity and be gentle with it. Ideally, if you want to get rid of it, you better keep doing the treatment. I haven't been patient enough to keep doing treatment. Otherwise, I probably could take care of the problem more permanently. So generally speaking, metal is not a big issue. Now, it's a big issue with MRI. But why is it a big issue with MRI? Think about MRI. Extremely high intensity, at least 10,000 Gauss to 20 to 30,000 Gauss. So what happens with very high intensity magnetic fields, static magnetic fields with metal in the body? Doing, right? That's why you have flying objects in MRI machines. It's the static magnetic field. But the other component of MRI is high frequency magnetic fields. High frequency, high intensity. And what happens with high frequency, high intensity? Around metal, you get a burn.
Mhm.
So basically what you do is with metal, you say, fine, gradually increase the intensity until you get discomfort. Back off from the discomfort, continue to do the therapy, and eventually as you heal the tissues. So I believe that every person who has a prosthesis, who's had a joint replacement, knees and hips especially, need to be doing permanent lifetime magnetic therapy. Why? MRIs clearly show that the prosthetics create osteolysis. Even within 2 to 3 years of a hip prosthesis, you will start to see osteolysis in the area of the stem. That's why they fail over time, right? It's because of the osteolysis. So magnetic field therapy increases osteointegration. So you actually get healing and you get better binding of the prosthesis into the bone, but you have to do it in a way that's, again, not going to cause more problems by overheating like you would with MRI. But these are, most of the PEMFs are not high frequency, so they're not going to cause burns because they're not high frequency. So usually you're pretty safe. Just go up to tolerance and then keep doing the treatment.
So Dr. McCulley, the pioneer of the homocysteine theory, is a friend of mine, and a few years ago, he told me that after he got hip surgery, that he would go driving and he'd come back in excruciating pain. And it was basically the Wi-Fi in his new vehicle. He traded it in for an old vehicle. His hips became an antenna. But
I think they absolutely can. I totally agree.
Yeah. Joy, unmute yourself and ask your question. And while she's doing that,
Jack, so with eye issues, glaucoma, macular degeneration, cataracts, those who've had cataract surgery and have intraocular lens placement, what are your thoughts?
Well, the eye is all connective tissue, so the eye is actually very susceptible to magnetic fields, and eye problems tend to do well with magnetic field therapy.
Okay.
But an IOP is not metal.
right.
So it's an inert material, but it's not metal, so it's not as susceptible to magnetic fields.
Okay. Okay.
So therefore, it's not usually going to be an issue.
Okay.
Cataracts are a problem. I don't believe that magnetic field therapy has much of a role with cataract, not because it's a problem, but because you already have cross linkages, protein cross linkages in the cataract that are locked in. So magnetic field therapy for cataract is probably much better with early cataracts as a preventative.
Oh, okay.
Okay, then to actually treat a full-blown cataract that you already need an IOP for.
Right.
A little known fact, because my mentor was an ophthalmologist at Harvard, is that the lens is the largest single cell in the body, and it's relatively avascular. So there's not a lot of transport through the lens. And then you get these amyloid formations, these unfolded protein responses. And so you can solve the underlying problem, but the cataract's not likely to be removed because of a lack of blood flow in that system.
Well, I think, again, if you are working around radar, or you're working around microwaves a lot, or you're out in the sun exposed to a lot of sunlight and you don't properly shade the eyes, you're already creating problems because of the microwaves, the environment, and the high frequency radiation that you're getting exposed to. That's what precipitates these proteins and causes the cataracts to progress. So if you haven't removed the causes, then it doesn't really matter what you do.
Right. Joy, do you want to come back on? You were on for a second.
Hi there. Yep, I'm here. Hi, Dr. Pawluk. I do have a question.
Hi.
Hi there. Back in 2016, I purchased from you. It was called the MAS Special Multi Plus.
Uh-oh.
PEMF. That was from Austria.
Uh-oh.
And So my question is, just after listening to yesterday's webinar, I think it is a whole body mat system, but I think kind of a lower intent, maybe it was considered medium. So 25 Gauss. And I know a lot of yesterday's talk was about the higher intensity for truly penetrating tissue. So I guess my question is that machine that I have one that is more for just kind of the body, the tune-up, kind of the acupuncture, meridian tune-up versus treatment?
Yeah, so the history behind the MAS, and I actually visited the factory in Hungary where they made them. And I was enamored of the MAS to begin with, largely because it had so many different programs in it. So I thought, this is great having all these programs. And as I started working with it and thinking about all the availability of all these programs, I said, it's totally confusing.
Mhm.
Right? It really doesn't really matter a lot. And the more research that I did, the more studies I read, and this is a basis behind some of my conclusions in the Power Tools for Health book. If you read through the studies, the tables are all over the place. Frequencies, intensities, treatment times, it's just all over the place. And so I realized with the MAS that basically there's only like 3 or 4 frequencies in the MAS that are worth using. Ultimately, I came to the realization it didn't matter what you did, because every frequency is going to have a benefit.
Mhm.
Some may be a bit better for other problems than others, but the intensity is where I came to the conclusion, and also working with a NASA, somebody who did research for the NASA program and did the stem cell study for NASA. He said it's all Faraday's law. And he worked with all kinds of magnetic systems at all kinds of frequencies. And he came to the conclusion that when you design a PEMF system, you have basically 1 billion variables to consider.
Mhm.
1 billion.
Yep.
And so the researchers who do most of this research are whispering down the lane. They're hearing somebody else had done the study, so they're going to pick up the same frequencies and the same intensities and maybe similar protocols, and they just replicate it. But it's not like they've done a test or a study on 10 different frequencies with 10 different intensities. So basically a big table plot. That doesn't happen. And why doesn't it happen?
Right.
Money and time.
It's very simple. If you have 30 variables, there's 110,000
Combinations.
Yep.
So the
That's
MAS is a good machine. It's low intensity, fine. Okay, it's no big deal. And the pillow applicator, I saw some miraculous results with that pillow applicator with a woman at a conference who was freaking out. And we put her on the pillow and put her on 3 hertz, and it's like night and day. I mean, she got off about 30 minutes later and she was raving about how well she felt. So it could still have a benefit. But the problem I ran into is value. Because of the low intensity, it's $5,000 machine. It doesn't do enough for the money you're spending. But if you have one, hey, great, use it. You don't have to sell it. You don't have to get rid of it. It's not going to cause harm. It's just not going to do you enough good. And there's a replacement device for that now called the Sedona Pro. Same machine, same technology, essentially.
That's the next question, actually, before Jack asks his question about the Sedona Pro.
It's basically the same. It's got some more features to it, but it's largely the same. They stripped down a bunch of the programs to make it simpler, but it's essentially the same. Same intensity, same sort of applicators. I think it's good. It's a good piece of equipment. It's just not worth the money.
Go ahead, Jack.
Dr. Pawluk, for those of us on a very low budget, let's say $1,200, might we best use microcurrent such as Alpha Stim or Avazia until we can afford $2,000 to $3,500 plus for PEMF if we want to focus on pain, inflammation reduction, sleep, depression?
Okay, so that's a really very important question. And I struggled with it myself. I've been trained in microcurrent. I spent like $6,000 or $7,000 in microcurrent devices. And I at some point I said to myself, what am I doing here? But think about it. What does microcurrent do? Where does it go? My description of a TENS machine is stomping on your toe when you have a headache.
Yeah, it relieves the headache pain potentially.
Right? It's interferential. So microcurrent produces frequencies into the nervous system that do basically what acupuncture is doing. It's not going to do a lot. If you only have $1,200, fine, use microcurrent. Actually, buy yourself a cheaper, buy yourself a micropulse. You're probably better off with that.
Yeah, that micropulse is a pretty
Mhm.
fast, actually.
It's what?
When the micropulse and the flex pulse, those are definitely within the $1,200 striking range. And
Well,
those
yeah,
are
the micropulse is $600.
right. And then the flex pulse is what, 1,200, right?
Right.
Yeah. So, and those are, yeah.
Well,
pretty-
does microcurrent interact with the brain gut vagus nerve axis, and does PEM do anything similar?
Well, PEMF is much stronger. It's much stronger. And it goes deeper, so you can get a lot better local tissue benefit than you would indirect benefits. Again, part of my discussion yesterday was that I learned to do magnetic therapy after learning to do acupuncture. And I realized magnetic field therapy does a lot more than acupuncture.
Mhm.
So you can get, as I said at the beginning, you can get any device you want and you're going to get benefit. Is it going to be is it the benefit that you want?
Right. And just
That's
to let
it. So
you know, when I heard Dr. Pawluk on the PEMF summit, again, it was a fabulous presentation, a lot of presenters there. But my first one, I bought the micropulse, and it's a pretty impressive device. I mean, it's tiny. I actually had no idea how small it was going to be, but it's pretty powerful for $600. Yeah, like Dr. Pawluk was saying, in that price range, for localized things, I don't think it can be beat at all. And it's comparing that to a QRS, right, Dr. Pawluk? Isn't it 200?
the QRS is 10. The QRS is under 1 Gauss. It's 0.7 something or other Gauss. So again, you get the whole body benefit, you get the acupuncture benefit, you get sort of nervous system, sort of mild stimulation of the nervous system benefit.
Right.
That's okay, but it's not going to heal your sarcoidosis.
Right. That's true. Right. Yeah.
What about something like
Just to recap, to recap, the micropulse will handle pain, inflammation, sleep, as well as depression well?
Well, to variable degrees, each one to variable degrees.
Okay.
What solves all those problems 100% of the time?
Mhm.
You need the big daddy.
Well, and even then,
I was going to say nothing.
even then, I mean, if you're not doing, if you're getting beat up by your spouse, if you're drinking too much, if you have a horrible job, and you're commuting 2 hours a day, well, I'm sorry, I'm not going to help you very much.
Yeah. Got to decrease some of those stressors, external stressors. Yeah.
You have to stop pouring gasoline on the fire. So that's a metaphor I frequently use as well. You're
Right.
expecting magnetic field therapy to put out a fire that you continue to pour gasoline on.
Mhm.
So what's going to win? We don't know. You may need
What
a
about something like
fire
bone,
truck.
what about something like bone spurs? Are there any kind of pathologies that are going to be refractory to this? Or it's
No, a bone spur is not refractory. I actually had a bone spur problem myself. So I was doing the micropulse on my bone spur, but you have to take the load off. So, and I walk 3 miles every morning with my wife, and that was aggravating my spur. So I got myself a new pair of shoes called Gravity Defier. It took the load off my heel, accelerated my foot forward so I didn't put as much pressure on the bone spur, and literally with the magnetic therapy and these new shoes, in about 2 weeks, gone. Hasn't been a problem since.
Wow.
two more questions, and I'll have Doris ask one if I can remember it. But let's see, bone on bone. I always hear a surgeon wants to do surgery. I think you can adapt to that bone on bone. My mother was bone on bone for 10 years and she was fine. But I assume that we can get some benefit even if all the cartilage between connective tissue is gone.
Well, I think the primary, the primary value of PEMF therapy in that setting is primarily pain reduction.
Right.
That's really an important question too. Is it PEMFs have been shown to regenerate cartilage, but it's like regenerating anything else. You need to have a scaffold. You need to have some of that tissue present to be able to regenerate.
Sure.
Right. You have to stimulate whatever cartilage you have, but it's got to. So that's your scaffold. If you're bone on bone, you have no scaffold. Right. So all you're doing basically is pain management, symptom reduction, maybe some improvements in functionality of the joint, but that's the expectation you have. So again, setting out expectations, making the expectations clear for your therapy is very important.
How about tinnitus? I get a lot of complaints about tinnitus.
Ooh. So there is plenty of TMS research on tinnitus, and there's enough research that they've done meta-analyses and relatively large-scale review results with it. Most of the time, it seems to provide a benefit. It's not 100%. So here's a problem with research. It's statistically significant, but practically insignificant.
Right. Yeah.
All right.
Well,
So in other words, you can get a 25 or 30% benefit in terms of the tinnitus, but they're not going to take it away. So people are frustrated. They spend money on these high intensity systems, which do show a benefit more than you can get typically from other therapies. Now, acupuncture helps tinnitus too. Okay, so there are a lot of therapies that help tinnitus, but there is no universal therapy that is 100% effective.
My therapy for tinnitus is when I don't sleep more than 6 hours, I have more tinnitus, and when I do, I have less. Believe it or not, that's my correlate. But
well, the theory behind tinnitus is that tinnitus is the brain filling an empty space.
That's why I have tinnitus. So many empty spaces. Holy mackerel, Carter, you were right.
Exactly.
The auditory cortex fills a gap. It says you're not hearing so well anymore, Doc. So that means I have to fill that space, and I'm going to fill it with sound.
Yeah. Interesting. Yeah. Go ahead, Doris. Fire away. I can hardly wait.
I would like to know how the therapy helps with detoxifying the liver. And you haven't said anything about all of the treatments with a program as far as diet. I don't want to use the word diet, but nutritional program.
No, I did talk about that yesterday, and I had a slide. You can't build a house without bricks and mortar.
And that video is up on YouTube already. I'll post it through the.
Oh, good.
Tomorrow. So
You absolutely need to have the proper nutrition to help tissues to rebuild and regenerate. You can't build a house without bricks and mortar. So if you don't have the proteins, you don't have the fats, you don't have the carbs, you don't have the electrolytes and so on, you're going to help, but it's not going to work because you don't have the basics to make that tissue healthy again.
So
in
in
regards
case
to
of no cartilage, can we try exosomes or stem cells to try to rejuvenate that and then overlay the PEMF to sort of promote that?
Prove it to me.
Well, Dr. Harshfield's not on tonight, but he spends a lot of time in that space being
No, I sure, why not?
yeah.
The only thing that I know of that will do that job adequately for you eventually is going to be a cartilage replacement.
Yeah.
But right now we're not there yet. There are research centers around the country that are doing cartilage implants, right? Ideally, it should be your own cartilage. And that's the future, clearly.
Well, there is one thing. So, I started, my stem cell journey way back when Dr. Centeno, I don't know if you're familiar with him, but he was one of the first doctors that was actually officially sued by the FDA. And he was expanding, the bone marrow stem cells. So he actually, he runs a clinic out the West called Regenerates. And then he actually had to take it overseas. He's actually in the Cayman Islands now, However, he did show conclusively that taking your own bone marrow, stem cells, but then you have to expand them. So of course, you really can't do that legally here in the US. You can only do that overseas. And that actually did show an appreciable increase in cartilage growth. Now, the other thing that is—
Okay, but Michael, you have to also tell us how much cartilage was left in that joint.
I understand. True. Yeah.
Right.
Yeah.
So my point is still the same, that you still have to have a scaffold.
That's true. Yeah.
I'll tell you why. I was at a conference at Cambridge
Yes.
called SENS, SENS, Strategically Engineered Negligible Senescence. Say that fast 3 times.
Right.
Right. And at that conference, there was a guy presenting from Stockholm about regenerating tracheal cartilage. Right. And that's where I learned that idea. They can't regenerate cartilage unless you have a scaffold.
Gotcha. Okay.
Right. Once you have the scaffold, you can grow it. You take the growth factors, you put it in place and so on. You keep growing it. And then eventually you put it back in the person's, trachea or their neck. And they brought that technology to Hopkins. And the first person they did at Hopkins had a successful transplant for about 3 to 6 months. And then he died.
Oh, my goodness. Oh, wow.
But anyway, the point is that you need a scaffold. And so if you're doing what you're doing with stem cells, and I believe that you're probably right, but if you have something to start with, and you have something to stimulate stem cells that are already there, then you're probably going to have pretty successful.
Right. Yeah, that's true.
So Jeffrey asks, I'm just on a contraindication here. I have a middle ear prosthesis implant, but my right lower ankle and foot always swell up. What device should I be looking to help with that issue?
Well, it's got to be, again, the intensity's got to be strong enough. So it's just a middle ear prosthesis.
You're not worried about that middle ear prosthesis?
No, because it's tissue.
Perfect.
I have the same answer to people who have valve replacements. If it's a porcine valve, I don't care. If it's a metallic valve, you better not.
Gotcha.
Got it. Let's see. Anybody else have any questions? I have some from yesterday. We talked about the.
Well, while Dr. Lewis is looking at this, this might be a question for others. What about long COVID symptoms? Also, post-vaccine injury symptoms? What's been your experience with you and your team?
I have a blog on my website about long COVID, long haulers. I don't know if you all know, but I got slapped on the wrist by the FTC. They came calling because I had a blog on my website about PEMFs and COVID.
Okay.
Fortunately, I had a paper published that they couldn't pull, but at least I had to take that blog off. So the answer to your question is that, I mean, COVID, fundamentally, the COVID infection is a hyperinflammation problem.
Correct.
Right? So PEMF therapy can be able to reduce that hyperinflammation. Vaccines are, who the hell knows what's going on?
Exactly. Right.
I don't know. But I think the root problem then is that if you have inflammation, PEMF therapy is going to help the inflammation. If you have damage from the inflammation, PEMF therapy is going to help the body to repair the damage.
Okay, good.
So that's sort of my general take. So anybody with long COVID should be on PEMF therapy, and the higher the better. If you have pulmonary problems, PEMF therapy will help with oxygen exchange. It'll help to decrease pulmonary edema and pulmonary swelling.
Oh, nice.
Right? It'll help to decrease inflammation in the airways. You probably will be able to cough less or produce less mucus. But with the right intensity magnetic field therapy, with the right amount of treatment time, you should be able to help long COVID significantly.
Nice. Okay.
It's a functional treatment, and we're treating functional problems largely.
Yep.
Absolutely. Okay.
Go ahead, Lynn.
I just have a question whether or not that would affect if you have stents in the heart. Does that a PMF interfere with the stents, or is it okay?
Very important question. So routinely, what I ask patients to do is to find out from the docs whether they can have an MRI. If they can have an MRI, I don't care. Some stents have metal in them.
Oh, yeah.
Right. And the stents also can recanalize reepithelialize, so they become sort of enmeshed into the body. But if they were told they can't do an MRI, then I warn off magnetic field therapy applied directly to the chest area, right to the heart area. I think anybody who has a stent has a lot of cardiovascular disease,
Peripheral disease for sure.
as well as peripheral.
Mhm.
And I have a blog on my website about heart failure. PEMF therapy and heart failure can be amazing. I don't think there's a single heart failure patient who should not be on PEMF therapy.
Oh, wow.
Because it's deadly. It's deadly.
Yeah.
Is there any insurance coverage whatsoever for this?
Fundamentally, except for the FDA approved machines, and they're only approved for those indications.
Mhm.
So the answer is that yes, if somebody has an FSA or an HSA or workers' comp or has something where I can write a prescription, then they can take it and then get reimbursed for it. PMFs are not covered under HSAs normally, naturally, because we don't have, we're not classified as an HSA provider, right? You have to be a provider that allows you to run a card. We're not an HSA provider. If you are an HSA provider, it's not a problem. But otherwise, as a physician, you write the prescription. They take their receipts and everything to the HSA, to their administrator, and then get reimbursement. But otherwise, insurance does not cover it.
You mentioned that COVID's a mega inflammatory cytokine storm, Bradykinin storm. Actually, Dr. Carter and I published a paper on this in 2020. We talked about exactly what you're talking about. The title of the paper was something like, the cytokine storm, but your pre-cytokine storm status is sort of what drives bad outcome.
And that's why obesity is such a problem, because these patients with a significant obesity are just loaded with cytokines already.
And in any of your practitioner networks, are people measuring CRP, fibrinogen, other myeloperoxidase, and other markers, doing the therapy and before and after, and seeing?
I'm not aware of anybody. There may be people who are doing it, but I'm not aware of them.
That's we run those inflammatory markers all the time. So it'll be interesting. Like right now, we're testing methylene blue with a number of people and seeing some interesting reduction in inflammatory markers. So just a sidebar, but it's worth doing. Let's see. What do you feel about having the device being used by non-licensed practitioners so they can't get their license revoked? That's my strategy.
Well, I know a lot of clinicians who use PEMF therapy who shouldn't be.
Yeah.
I think often
a lot of clinicians that aren't using it that should be. So
clearly that too
all balances out, right?
And I certainly know a lot of people who are not licensed who are more thoughtful often than the clinicians are who are using it.
Right, of course. Right.
I mean, from my perspective, I know a lot of clinicians who buy, use, and sell beamers.
Right. Yes.
Mhm.
Duh.
Yeah.
Well, that sounds like the FDA to me.
I'll tell you a little story.
No
I
big deal.
routinely get asked by people, where's the evidence? So my first book on magnetic therapy in Eastern Europe, I had a doctor friend in Canada who was talking to doctors, and they said, where's the evidence? So he took the first book and he dropped it on the floor. Slap. He said, there's the evidence. End of discussion.
Mhm.
All
Right. So basically, we can present the evidence to people, but you can lead a horse to water, but you can't make him drink. Actually, I've learned over the years, you can lead a horse to water, then you start an IV.
Right.
If you haven't done a multi-billion-dollar randomized clinical trial, there's always going to be clinicians and the major pundits that are going to deny the efficacy of the treatment.
No matter what, they're going to deny it.
My favorite example is you do 1,000 people in a randomized clinical trial. Then you have the Korean study published in Nature on 12.8 million Koreans, showing that the ideal cholesterol number is around 220, and everybody's in denial.
Hey.
It's not a randomized clinical trial. It's only 12.8 million people. How could that? How could that be relevant?
How many people do you have to study to show that they've lost an arm when you do an amputation?
Right.
That's a really good question. Is it a trick question? I'm not sure I want to take that one on.
Dr.
Let's-
Pawluk, do you have a theory on, I'm sure you do, on emotions or even long-term storage of emotions in the fascial tissue? What do we think PEMF is doing for emotions? I don't want to go too far
Well,
down the
think,
rabbit
think,
hole.
but if you think about it for a second, what's emotion stored in the tissue?
Well, I would think of it as an electromagnetic frequency signature of some point.
Exactly.
She said that's what Geneva told her.
I think
Exactly.
narcissism.
So a connective tissue, current flows through connective tissue at the rate of about 30 meters per second.
I'm having the same problem with individuals myself. They don't want to start until after.
Doris.
So
You're here.
connective tissue is basically cross-linked fibers, right? They don't have nuclear material, they don't have membranes, but because they're fibers, they have a lot of charge associated with them. So when you pass a magnetic field into connective tissue, the amount of charge you produce in that connective tissue is huge compared to a cell membrane. So whatever you stored or loaded electromagnetically in that tissue is going to be bumped potentially by the magnetic fields.
I mean, most mood disorders have an inflammatory component. You know, what the brain, see, my mentor being an eye doctor, there's what's called ocular immune privilege. So fatty tissue like the retina and the brain perpetuate inflammation more so than other tissue. And so that's why we have all these mood disorders, because of the bad diet and bad seed oils and all that. It's pretty well studied. You know, if your eye swelled like, you know, a knuckle or a joint with a little inflammation, you'd lose vision, right? So that's why we have this immune privilege approach. And it's, you know, persistent inflammation in the brain is not uncommon. And so anything that's anti-inflammatory is going to be helpful to that, Andrew.
I would agree.
When taking them to discomfort, how does that show if a hypersensitive person will be able to handle the end result of the treatment?
I'm not sure I understand the question. So if you take
I
them,
think we're referring to people that might be hypersensitive and how you ramp up or something, and then.
well, yeah, you have to clearly do it more gently, and of course you have to know the patient too. Again, a lot of these hypersensitive patients, it doesn't matter what you do, even if they win the lottery, they're going to cry. Anything positive is still a disruption to their normal state, their homeostatic state, which is abnormal in the first place, but it's a disruption. So it could be a positive benefit, but it's still going to be disruptive to them. So even tiny increases. Well, there was a study done, actually, interestingly enough, that you asked that question. There's a study done on hypersensitivity, EMF hypersensitivity in Sweden, where they blinded people to whether the magnetic field was turned on or not. And they had a group, they had a placebo group, and they had a group complaining of hypersensitivity. And what they discovered is they could not tell when the field was turned on or not. If you told them the field was turned on, they'd have a nocebo response.
That's your borderline personality folks you referred to yesterday.
Well, or they're just, again, they're just so damaged psychologically that, you know, anything is a threat.
Mhm.
And I had a patient like that. It didn't matter what you said. She was going to perceive anything she wanted to perceive as a negative because she wanted to perceive it as a negative.
Mhm.
So, Dr. Pawluk, I'd like you to comment on this, and that might go toward a couple other people on the call, because I was on one of the big daddy systems out there, you know, the $50,000, $60,000, I can't even remember what it's called. Very ultra high intensity. It was a coil that was placed around my neck, right?
It's like a PAPME. Was it the PAPME?
I can't remember, but I could feel that. When it was turned on, I could feel the current going through my entire body. And I was, me personally, I was super sensitive to that. So they had to turn it down. So, but again, I mean, it definitely depends on what the practitioner knows, what they're using and all of this stuff. But just because they have a $60,000 machine doesn't mean that they can, you know, use that on everybody and, you know, and get a great result. So there's some very powerful systems out there that are, I mean, generally in practitioners' offices, right? I mean, most individuals aren't paying $60,000 for their home, but yeah, I mean, those things can be revved up.
They can be very revved up. Now, do you know why TMS was developed?
No.
ECT.
Okay.
ECT is barbaric.
Oh, electroconvulsive therapy.
Yeah.
Oh, that's how that came out of it? Oh,
They basically wanted to avoid ECT and all the problems of ECT, having to use anesthesia, having to use muscle relaxants and so on, trying to avoid dental fractures and spinal fractures in these patients. So they want to find another way to stimulate the brain. And that's why even today, the concepts of TMS are much more related to all the to ECT principles, which is to generate current in the brain. Than it is to think about all the other sort of actions of PMFs across a skull or into a brain. It's now being recognized more and more and more that it's not just the electrical stim to the brain that's doing the work for depression, because that magnetic field disseminates through the whole brain. It's not just that local electrical stim, but the reason that it was developed was because of ECT.
Interesting. Okay, very good.
So it's an ECT replacement.
So did I miss something? The energy kind of reflects through the brain?
Well, you are generating the principle behind ECT, at least that's the principle they hold on to, is that you're stimulating charge production in the brain proximal to the coil.
Okay.
And they think that causes a reset, an electrical reset of the brain. But it's a magnetic field.
Mm-hmm.
And because it's a 10,000 Gauss magnetic field, how far does a 10,000 Gauss magnetic field go? To the brain next to you.
Exactly.
Right. Yeah.
Right? It's not just resident in that brain, it's going throughout that whole brain. And like you said, Michael, it's strong enough to actually begin to go to other parts of the body as well. So
yeah, you can feel it.
That field is big, it's pretty strong.
Yeah, very strong. Yeah, I could actually feel the vibrations to my body. So again, I think, and this was a number of years back when I think the big daddies came out and they were kind of playing with it. And they're like, oh, if you haven't felt a PMF, let me show you what this really looks like. And yeah,
you had a massive depolarization.
Yeah, exactly. Exactly.
Dr. Pawluk, as we come to a close tonight, a number of people are saying, how do I get a consult with you and things like that? Can you kind of explain what you or your immediate team is actually doing to as a business model to help people with this technology?
So let's classify it into two groups of people. One is the professional.
Sure.
So, and we can have a discussion with professionals for their particular practice, their needs, and that's usually an individual consultation, about a half an hour.
Right.
We routinely provide consultations for free to consumers. But I warn people, I tell people, if you want to spend $300 or $500 for a system, don't bother. I don't want to spend a $200 half hour, my $200 or your $50. My website, my books are full of information. You can get all that you need from there.
Mm-hmm.
So if you're serious and you're going to respect me in my recommendation for you, and that I may make a recommendation for you for a $12,000 machine, then you have to be prepared to do that.
Mm-hmm.
Right. So people can go on my website on drpawluk.com, and on the right side, request consultation. So if you're really interested and you're willing to spend the money you need to spend for your own health, then ask for a consultation and we'll book you, we'll set you up.
And are you still in Baltimore and have a system, or you are not seeing people?
I retired 2 years ago.
Good for
So now all I do is PMF consultations and.
Well, you're not really retired.
Writing. I'm not retired. I'm still doing patient care.
Likewise. Yeah. With you.
And then you have your team, right?
Yes, we have an acupuncturist working for us, and we have a chiropractor.
Right.
They both have many PMF devices. They're both very skilled about this technology as well.
And you can do online Zoom consults or whatever as well.
I don't normally do Zoom consults. I just do telephone consults.
Okay. Good for
you.
We don't
But
need
yeah,
CCP.
I don't want people watching me. pick my nose or whatever.
Yeah, I'm with you.
Right.
With you. No, this has been fascinating. I mean, I had someone saying, the beamer, then the cloud, and it's really important to talk to an expert on this because, like you said, the number of permutations are absolutely vast, and so we need your kind of expertise to hone in. And it's very clear that your science is first in your pedigree. So,
well, also thank you for that. Also, my clinical background. I mean,
yeah.
Having done family medicine for 50 years, how much can you be snowed?
Right. Yeah.
Well, they've tried every which way but Sunday, right? And you just persevered.
Absolutely. Absolutely.
Well, I kept running away and trying all these different machines, so I never stayed in one place too long.
There you go.
Beautiful.
Stay stealth. Stay stealth.
Thank you.
Dr. Pawluk, thank you so very, very much. Very
Well, does he have used machines?
We
Oh,
rarely have used equipment.
Okay.
Because most people who buy their equipment are getting it, hopefully when we do it right, they buy the right equipment and they use it right and they don't need to return it. So we do occasionally have used equipment. We do have a couple of devices that we have on rental. I saw a question about 5G.
Yep.
Okay, that's actually an important question too.
Yes.
Magnetic field therapy does not protect you against 5G. It's not a shield.
Mhm.
You can make your cell phone not harm you by wrapping it in aluminum foil, but then it's not a cell phone anymore.
Right.
All right.
Yeah.
So magnetic field therapy, the goal of magnetic field therapy when it comes to 5G, people misunderstand 5G, and I think there's a lot of whisper down the lane and overhyping of the risk. The big risk with 5G is we all have to face it. We all face microwaves around us all the time, and radio signals and TV signals and so on. It's ubiquitous. So they are landing in our bodies. They're acting through us, but they're not strong enough to cause a major problem. Now, so what happens is if you happen to live downstream from a cell tower, or you happen to have a smart meter on the side of your house where your bedroom is, well, then you're going to have a problem. The dose basically becomes pretty high and high enough to be a significant problem. But magnetic field therapy basically rebalances the body. Okay, if you're perturbed by these frequencies, by this radiation, if you will, then the body reacts in a negative way, usually with inflammation as a primary action. Then what you do with magnetic field therapy is you're restoring and rebalancing the body. If the dose is really high, I mean, if you come to me and I burn off a wart on your hand, don't come to me and ask me to heal the tissue that you just burnt.
Right.
Right? Because you burnt it on purpose. Now, you may be able to heal faster from it. So PEMF therapy then basically helps the body to restore itself and rebalance. But in order for you to offset environmental radiation, like 5G, you need to be doing magnetic therapy every day because you're exposed to it every day.
But you need a full body for that, though, then.
Well,
right?
ideally you should. There was an interesting study done with people with, and they had an interesting theory on how amount of blood you're exposing. So they thought if you're exposing a chest with magnetic field therapy, you're going to have a lot more blood exposure than you do by exposing an arm. And so their idea was that they were going to treat these leg wounds, ulcers in the legs, vascular ulcers, using magnetic field therapy to the chest or the arm. And and then they compared how long it took people to heal with those stimulations. Again, peripheral, they weren't to the wound. And they healed in about the same time the standard therapies healed, about 30 days.
Really? Oh, okay.
Right. So you get a systemic benefit from any exposure, PEMF exposure. It's just not going to be as strong as doing direct local therapy.
So you can get a system that has a substantial, like a pad system, right? That delivers a decent amount of gas. So let's say someone with an ulceration, because in my circle, diabetic foot wounds and stuff like that. So you would say, and someone can't afford a $12,000 system, right? Then
or a $6,000 system.
right, or a six, yeah. So then what would you say would be reasonable?
Well, if they got a foot wound, then you put a micropulse on the foot. But even let's think about it for a second. And we're actually working on one of these devices, which hopefully we'll have available by the end of 2023. I discovered that if you treat the belly with a PEMF pad of around 200 to 1,000 Gauss, what are you doing by treating that belly?
It's treating everything then.
Essentially treating everything in that belly.
Right.
But you're also treating the whole circulatory system because everything's passing through there and going to the rest of the body.
Good point. Good point.
And you're tuning down the VNS. Or you're actually increasing, a vagus nerve stimulation at the receptor site. So it's parasympathetic stimulation. And because the gut is a second brain.
Right. Of course.
Right. If you give the gut 3 hertz frequencies, then what happens is the nervous system hears those 3 hertz frequencies and it quiets down the brain. So you basically run it all night long to treat anything that's going on in the belly. While at the same time stimulating the VNS, while at the same time doing tissue stimulation, while at the same time doing doing acupuncture therapy. So this should be a very handy tool for us going forward as well.
You're developing that?
Yeah.
Oh, good. Very cool. Okay. Well, definitely keep us posted on that because that's awesome. Because the gut is the center of everything. Healing the gut heals a whole lot of things.
I may put myself out of business.
Well, no, you'll sell a lot of those though. Absolutely.
Is there any overlap with shockwave? That just made me.
That's also a more recent discussion. I've been doing quite a bit of reading about shockwave therapy. Well, shockwave is, again, it's a sonic wave.
Right.
And when you're pushing tissue, when you're pushing connective tissue, it's the piezoelectric effect.
Create an electric current.
Yep.
You're creating currents for sure.
Right.
So it's not just the shockwave itself to try to disrupt or break up calcium deposits.
Right.
So then because you're stimulating current, then you're doing all the downstream effects that you get with PEMF therapy, except it doesn't go deep. So one of the problems with shockwave therapy is very local. And if you want to go deep, then you have to do lithotripsy and you have to put somebody under anesthesia because you can cause arrhythmias.
However, I'm on the medical advisory board of a company called Softwave. Ours is an unfocused device, and it does actually go pretty deep, like 8 centimeters. So it's pretty deep, and it's an unfocused.
It still drops off dramatically, but
well, again, right, like you said. So, and that was very interesting when you kind of went through when you put a PEMF probe on someone, and then how it degrades as you go through the tissue. So I agree with that.
Most shockwave therapy that's affordable is local.
Well, ours is a $75,000 device though, so it's
there is that problem too.
True enough.
Right.
True enough, but maybe for certain targeted issues.
Right. Exactly.
I agree with you. Again, it's another tool, and it can be very effective depending on the practice that you're running. And
right.
It just sounds like PEMF has a lot more versatility based on the device availability, affordability.
Well, yeah, and you can actually buy one for the home. You can't really buy a really good shockwave device for the home. It just doesn't work that way. No. Yeah. So
Andrew, thank you for that question. I wasn't going to bring it up until I talked to Dr. Carter, but I'm glad you brought it up.
No, that was a good one. That was a good one.
No, that was an excellent question.
Absolutely.
I have a relevant comment about about Dr. Pawluk's stomach treatment. There's a podiatrist in Florida that's had a very 95 to 99%.
Oh, I know Ira. I know Ira. I talk to him regularly.
Oh, okay. Very good. Could you share the comment on how with the technology that he uses, that company suggested treating the liver?
Yeah, I'm still on the fence about this. The technology is derived from the Diapulse. And the Diapulse is a $25,000 machine. There's a company called IVV, and they also have another company called Soft Pulse, or a device called Soft Pulse, which has been used extensively in nursing homes. And there's a veterinary version of that called the Assisi. And it's a loop. And it's high frequency, modulated high frequency, so it's non-thermal. And the FDA has created a new category of non-thermal diathermy. And so diathermy can be very effective. The problem with a lot of these devices, especially the Assisi and the IVV, is that they're disposable. When I was on the Dr. Oz show, he had me look at a device called the ActiPatch, which essentially is a similar device, high frequency modulated, and it's a throwaway. So $25, you use it until the battery dies and you throw it away. So I really don't like that model. These devices are not strong enough that you could just do 2 or 3 hours of treatment and get a full benefit. So an IRA is doing something very different. He's using that technology along with xylocaine and along with other anti-inflammatories that he injects into the tissue. So I don't know when you're talking about the belly, and there are lots of studies on that particular technology, that stimulus or that waveform, and I think it's very good. I would like to be able to get enough money to be able to develop a device that's like the Diapulse but bigger, to treat a much bigger area. But as I said, the Diapulse is $35,000, and the head on the barrel is only about this big. So it's just very local.
Oh, okay.
And financing, we have a program we work with, NCMIC, NCMIC. It's a lease to own program. Otherwise, we often tell people to get a PayPal account and apply for PayPal credit. It's hard to get financing for these devices. If you're a clinician, you can apply for a lease to own program. And you may have something that you use yourself, but we do have a program that we use or recommend for clinicians.
Right. Okay.
Excellent. Excellent talk. So if anybody wants to see the initial talk, it's out on YouTube. I'll send out a notification tomorrow with a summary through the blog if you signed up for that. And then this one hopefully will pop up, because I think the information is so valuable and timely. So we'll get that out in the next couple of days.
I really enjoyed this opportunity to share with you.
So did we.
Yeah, it was awesome.
Thank you for all your work, Dr. Pawluk. We appreciate it.
Thank you much.
My pleasure to you all. Enjoy the rest of your evening, and stay warm, stay cool, stay dry, stay whatever you need.
Thank you. Great clinician. Take care of now. Bye now.
Okay, bye-bye.
Bye.
Thank you very much.